Another area of great interest in today's practice is to have pharmacists involved in the process of monitoring oral oncolytics. We are seeing a transition of many treatments coming from the infusion route of administration to the oral route of administration. And this provides pharmacists with unique opportunities to get closer to the patient. It is a standard to have in an infusion center 2 pharmacists verified orders, and you also have a physician or another provider placing an independent order. Sometimes you have other personnel like pharmacy technicians doing an independent pharmacy calculation. And all of those steps are in place to make sure that we provide patients with an accurate treatment and accurate dose. Oral oncolytics have less checkpoints, and that is where we can come in to help. Oftentimes those medications are written in a prescription or sent electronically to other pharmacies, and those pharmacies may or may not be familiar with the disease state. Definitely they're not going to be familiar with the patient if they are a specialty pharmacy. So that creates opportunities for potential errors. So the pharmacists that are overseeing the care of the patient have a unique opportunity to oversee that process and intervene as necessary. Oral oncolytics are equally potent systemically, many times compared to infused chemotherapies. So we need to be mindful of that. We need to educate patients accordingly. And the pharmacist's role is also to ensure that the patient can derive the most benefit that they can from that treatment. Many times when patients are in oral oncolytics, their treatment options are already very limited. So if they don't adhere to the treatments appropriately, they can develop resistance, and that would mean that they would need to escalate therapy up. With every therapy escalation, there is usually more toxicity, there's usually higher cost for both the patient and the payer. So the pharmacists are there in the clinic trying to enable that process to ensure patients respond as long as possible.